Dr. Nathan Cole knew more about opioid addiction than most people on earth. He lectured on it, he treated it, he watched it destroy patients. Then he became one of them. He had a medical license, a private practice, and a prescription pad. For 2 years, he used all three to feed a habit his patients would never know about. This is not a story about a bad doctor. It's a story about what happens when the person who knows all the warning signs ignores every single one of them. Nathan graduated top of his class. Medical school, residency, fellowship, 15 years of training. He specialized in pain management. He chose that field because he genuinely wanted to help people in pain. He opened his practice at 34, pain management. Patients came to him suffering chronic pain, nerve damage, post-surgical recovery. He helped them. He was good at it. The stress of the job was significant. Pain management means managing suffering all day, every day. Patient after patient carrying something unbearable. In his 5th year of practice, he threw his back out, moving furniture, genuine injury, genuine pain. He prescribed himself a short course of oxycodone, completely legal, completely standard. The pain went away after 2 weeks. He kept taking the pills for 6 more. He noticed something during those 6 weeks. The pills didn't just kill pain. They killed everything else too, the stress, the weight of the clinic, the patient suffering he absorbed daily. For the first time in years, he felt nothing. It was a relief. He knew what was happening. He had diagnosed this exact pattern in patients 100 times. He told himself he was different. He was a doctor. He could manage it. He wrote himself a second prescription, then a third, each one documented as a back injury follow-up. His own patient file, his own signature, his own judgment. By month 4, he needed the pills to get through a normal workday, not to manage pain, to manage everything else. He was a good doctor while he was using. That's the part people struggle with. He didn't make mistakes. He didn't harm patients. He showed up. He focused. He helped. His wife noticed he was calmer than usual. She thought the stress of the practice was finally leveling out. She was relieved. He began writing prescriptions for patients who didn't need them, small amounts. Patients with minor complaints who he upgraded to opioids. He told himself it was compassionate care. He began diverting taking pills from sample supplies kept at the clinic, small amounts from many sources. Untraceable, he thought. His tolerance increased. The dose that worked in month 1 didn't work in month 8. He needed more. He found more. He attended a medical conference on opioid prescribing practices. He sat in the front row. He took notes. He had 40 milligrams of oxycodone in his system. His nurse, Maria, noticed the sample supplies were running short. She reordered without mentioning it. Then it happened again. She started counting. Year 1 ended. He was taking 120 milligrams of oxycodone daily. He had told no one. He had harmed no patients. He believed he had it under control. His son was 8. He coached his soccer team on Saturdays. He never missed a game. The drug kept him level enough to be present. He thought about stopping every week. Withdrawal from opioids at his dosage level, he knew exactly what that looked like. He had supervised it in patients. He couldn't afford to go through that. He researched tapering protocols. He wrote out a schedule for himself twice. He never followed it. Month 16. A patient complained that his prescription seemed unnecessarily strong. He switched pharmacies. He was more careful. Maria brought the inventory discrepancy to the practice manager. Not Nathan, the practice manager. She had documented 6 months of shortfalls. An audit was ordered. Nathan didn't know yet. He saw patients that day, coached soccer that Saturday. The investigation had already begun. The audit found irregularities in 18 months of records. Prescriptions written to patients who later reported never receiving them. Sample supplies consistently short. The pattern was clear. The practice manager called Nathan into the office on a Tuesday morning. He sat down. He saw the folder on the desk. He knew immediately. He didn't deny it. He sat in that office and he told the truth for the first time in 18 months. The practice manager was not prepared for that. His medical license was suspended that afternoon. He drove home. He told his wife before the children came home from school. His wife's first question was not about the addiction. It was, "Did you hurt any patients?" He said no. She believed him. That mattered to her before anything else. The state medical board opened an investigation. A DEA referral followed. He hired a lawyer. The legal fees began immediately. Withdrawal began on day 3 after the suspension. He had tapered nothing. His body had no preparation. He spent 4 days in a hospital detox unit. His son was told his father was sick. He was 8. He made a card and gave it to his mother to deliver. It said, "Get better, Dad. I saved you a seat at my next game." The DEA investigation found no evidence of patient harm, diversion for personal use only. His lawyer called it the best possible outcome. Nathan didn't feel like it was. He pled guilty to a federal charge of prescription fraud. He was sentenced to 3 years probation, a $50,000 fine, and mandatory treatment, no prison. His medical license was revoked. 15 years of training, gone. He was 41 years old with no career and no clear path back to one. His wife stayed. She made one condition: complete honesty from that day forward about everything. He agreed. He has kept that agreement. He attended a physician health program specifically for medical professionals with substance disorders. He met surgeons, nurses, anesthesiologists. He was not alone in this. The program director told him that anesthesiologists and pain management specialists have the highest rates of opioid addiction of any medical specialty. He had known this statistic. He had never applied it to himself. He completed the physician health program. 2 years of monitoring, drug testing, therapy. He passed every test. He attended every session. He applied for license reinstatement at 43. The board denied the first application. He applied again at 44. The second application was approved with conditions: supervised practice only, mandatory monitoring for 5 years, no controlled substance prescribing. He returned to medicine in a different specialty, not pain management, public health, specifically addiction medicine. He treats opioid-dependent patients. His patients don't know his history unless he chooses to share it. Sometimes he does. He says it changes the conversation completely. His son is 12 now. He knows the broad outline of what happened, not every detail, enough to understand. He still saves his father a seat at every game. He keeps the card his son made during detox. It's in his desk drawer at the new clinic. He looks at it on hard days. He is 4 years sober. He is monitored quarterly. He accepts this. He says the monitoring is the most honest relationship he has with medicine now. He speaks at medical schools now about addiction in medical professionals, about high-functioning dependency, about the gap between knowing and doing. He tells students, the most dangerous moment is not when you first use, it's when it works. When the drug does exactly what you needed it to do, that moment is the beginning of the end. Maria, the nurse who reported him, works in a different practice now. He wrote her a letter 2 years after the investigation. He thanked her. She never responded. He understands that. He has thought about what would have happened if Maria hadn't counted, if the audit had never been ordered. He thinks he would have kept going until a patient was harmed, or until he doesn't call himself a recovered addict. He calls himself a doctor in recovery. The distinction matters to him. The disease doesn't end. The work doesn't end. Neither does the practice of medicine. Dr. Nathan Cole prescribed opioids for 15 years. He was addicted to them for 2. He lost his first career, his reputation, and 2 years of his life. He got back his license, his family, and something he didn't expect, a reason to practice medicine that meant more than the first one.